Give it another minute or two for Paula.
I'll just make sure she's not struggling.
I'm just looking at the packet I sent out, did not contain an agenda.
No, you sent one earlier though.
You know, it's posted as well, so.
It's taken me a little longer than I thought to gain my stride. And I'm sorry, I was mentioning before you guys, everybody got here, I'm a little anxious tonight. I have no paperwork in front of me. I'm used to flipping through pages as we're going along, and
Right.
hopefully I can keep up, okay?
I'm sure you can.
Yeah.
We'll all muddle along. This is good. This gives me a minute to look at the document you just sent. I had a little, my dad was having a little bit of a worry about his apartment, so I was working with him instead of looking at my paperwork myself. So
Priorities.
that's right. That was what needed to get taken care of, but now I have a minute to roll through.
Maybe we should get started. Did you hear anything from Paula, Jean?
I just texted her and sent her the link again.
Okay. Okay, well, let's call, I mean, I'm sure she'll call in momentarily. Why don't we just call the meeting to order? So people got the agenda, hopefully, and it's posted. I wanted to actually make a few comments, and based on reflections of my first 100 days with the board. It's just like a little over 100 days. So,
Wow.
Congratulations.
Thanks. So a couple things. One is just to acknowledge all the board members, full and associate, for their commitment and participation. I'm a little bit humbled because I practiced, I've been in the town for like 26 years, busy raising a family, 5 kids, and busy career. And I've never, committed time to the town or the community because of that. And so I'm kind of humbled by all of you on the board who have day jobs. I'm retired now. You all have day jobs, and yet you still, and a busy family life, many of you, and you still find the time to do this. So it's actually pretty humbling. And I think, as I thought about what each person brings to the board, it really is a different knowledge sets and perspectives. And so, really the whole is greater than the sum of the parts. So just to acknowledge that. Secondly, wanted to thank both Bob and Jean for their, support in public health. And I know that the resources are just going to flow endlessly over the next few months as we do the budget process. And obviously to the health division staff who do the day-to-day heavy lifting. And finally, a special thanks to the last 3 board chairs, Carrie, for jumping in the breach and covering those last couple months. And also to Eleanor Shonkoff and Amy Dove, both of whom outreached to me after they left the board and gave me some insights, background, wise counsel, and that was very much appreciated. So I have one other sort of comment to make, and that is just some goals I have. I tend to be more goal-oriented. And so I thought about this and, what is it that at least I would be looking at? And this might be something we want to have for an agenda item in the next month or two. But there are really 4 goals that I'm hopeful for. One is ongoing management of the COVID pandemic. Obviously, that is a very high priority. And whether it's vaccinations, what we're going to talk about today in terms of opening town hall, lot of activity, and it is still ongoing. When I take my daily walk, there's people have been putting out signs and little stones with messages out there to try to encourage us all during this period. And there's one little stone next to the train station that I walked by, and someone wrote on it, it'll be better in the end, and if it's not better yet, it's not the end. And I think that's where we are with the COVID crisis. It will be better ultimately in the end, but we're definitely not done. So focus on the COVID. Secondly, complete the assessment we're going to do about the functioning of the board and the division. And I think, having Peter on board is kind of already started that process, but we have those consultants that ultimately we would hope to also weigh in, because I don't think we can really do our job until, we have ourselves in a position where we're running well. The third is, we've talked about doing the community needs assessment and a community health improvement plan, and those are still, in my mind, on the docket, probably for early next year, but something that we do need to get to and update the 5-year plan. And then finally, the fourth goal I have is helping the board function as best as it can. I think that it wasn't lost on me that that I'm the 4th board chair in the last 12 months, and the fact that when I looked at the minutes from November 2019, other than Kevin, who's been a rock, we're all new to this process. So that degree of turnover, I think says something. And I think in part that's been due to the intensive time commitment, which is, understandable during a pandemic and an under-resourced health division, but it's not sustainable over a long period of time. So, fortunately, Carrie moved us to twice a month. And, I think that in my mind, and I've talked to Peter and Jean about this, in order for us to get to the point where we can maybe even meet monthly, like many of our colleagues in surrounding communities, we have to be at a point where we can feel comfortable that there's a lot of transparency with what is going on for the day-to-day kind of, ongoing work of the health division, and we can know that that's being done and comfortable about it, and know that, when problems arise that are serious enough, they're brought to us. And we don't necessarily therefore have to get into as much day-to-day detail as we've necessarily have needed to be. So that's ultimately my goal. So those are just kind of so you know where my head is going forward. Let me just review the agenda. Hopefully you have it in front of you. This format's a little bit different than we've been looking at. It's a format that I was used to in the place where I worked, which is putting a column for purpose, which kind of tells you, are we, oh, thank you, Jean. Are we making a decision? Are we just getting informed? Is it a discussion? Are we approving something? That just helps clarify things. And then who the lead speaker is. So we're going to start out tonight with public comment. I didn't see anybody from the public online, but so that will be quick. We're going to review the minutes that Jean and Peter had sent out. That should be relatively quick as well. And then go over Peter's report, his ideas, his preliminary ideas about how to structure some of the work in the department. And then we'll be talking with Bob about the document he sent this afternoon and any other updates we need to connect on. And then there's the usual COVID updates and then sort of a brainstorm of next agenda items. You know, I think we will be able to finish well before 9 o'clock and be able to go back and look at the electoral map and see if any of the colors have changed. But I think that, you know, when we had originally planned to extend this meeting, we were thinking that we would have the report, two things. One is that we were thinking we would have the proposals back from those 4 consultants, but they're not back, or they're back today. And so that should presumably be on our next meeting agenda, having been reviewed by that subcommittee and make a recommendation. And then secondly, we thought that John Doherty was coming to talk about the schools, and he decided that he didn't need to. He sort of sorted out whatever he needed to sort out. And so with those 2 big items gone, I don't think we'll need 3 hours, but you know, we'll see. Okay, so since there's nobody from the public online that I see, why don't we just move to the review of minutes? And Jean, do you want to just kind of preface this and you can go from there?
Yeah, sure. So you got 11 sets of minutes, and they date back to May. Couple of minutes a month. I think July maybe had 3. Everybody gave me their comments individually, so we're on the right side of the open meeting law. And I have everything in track changes. I emailed that out to the board about a week ago, and I think the track changes version incorporates all of the changes. I can pull them up one by one, or if everybody's had a chance to review them and is ready to vote, then the board can vote, however you want to do it.
I would suggest that since everybody's had a chance to look at these and previously give input, you know, if there are specific minutes where there are specific amendments or edits that people would like to do, you know, maybe you can bring that to raise your hand, and kind of we'll have Jean perhaps share that particular minutes on the screen, and we'll go over. And then once we agree on any edits or final amendments, we can just approve them en masse, similar to what we did last time. So are there any particular comments or edits on that final? No? No? Okay, can I have a motion to approve the minutes? And Jean, oh, thank you, Carrie. Do we need to
Approve.
do we need to list those dates, or like we did last time, or can we?
Yes, I can provide those if that's helpful.
Okay.
May 8th, May 11th, June 18th, June 29th, July 13th, July 20th, July 23rd, August 6th, August 10th, October 1st, October 8th.
All of 2020. Don't leave that out.
Yes.
20. Thank you, Kevin.
I know we want to leave it out, but you can't.
Make it go away. Okay, so so Carrie's motion, I would second it with those dates. Roll call, Rick, aye.
Carrie, yes.
Yes. Okay, motion is approved. All right, Peter, it's all yours.
Well, I hope the the general, I call it general correspondence. It needs a flashier name, I guess, but before the Board of Health meets, I like to give them some talking points so we can stay on task. And I sent that along. If there are any immediate questions, I'll air them. You were welcome to send it off to me in the first place, but maybe I'll try to, well, I don't think we have to screen share this, but here are the key points on my report for this meeting. And well, thanks to Gene and Bob, they've been really open to the ideas on restructuring, and it's become apparent to me that there's a lot of changes that could occur to make us run more efficiently, and especially be able to track what we're doing. And I won't get into any of the dramatics, but I really don't know much about our programs, our permitting programs, and our mandates. And this is different than COVID, but I mean, there has to be a health department operating
Yes,
behind the scenes.
Yes.
yes.
So, the very first thing is let's get a foundation built. And again, Gene and Bob have been supportive when I come up with 3 programs, and I think they're typical on all local boards of health. But I've decided that we're going to report out on a regular basis under the title of epidemiology, and that's been tasked to our public health nurse, and she's perfectly capable. She's really an outstanding and a leader in the field, for that matter. I haven't needed to do the legwork investigating on her. People know her and respect her, and I trust her impeccably. But so she will be giving us nurses reports, and she gave me one this morning that you haven't heard yet, but I'll probably be able to pitch in under the agenda item COVID. But you got the nurses report that was separate from my packet. I left that out. And again, all I can say is I'm trying to find my stride here, getting back into this, but it'll come. And the next one is environmental health. And this is everything. And there's a finite, I mentioned this last month, or maybe I mentioned it with Rick when we were talking, but there's a finite number of environmental health headings that Board of Health is responsible for. And they range from air quality, indoor air quality, or even complaints about odors, all the way through to the housing, food safety, the public and semi-public swimming pools, animal control, pest control. And I will outline those. I think the last time I was here, I said we'll begin a class on local public health 101. And I guess I'm just poking at it right now. But the environmental health piece, a lot of moving pieces with it. And we want to be able to plug in and capture what's coming through across our desks. And so technology department has been really looking forward to this whole thing. Now, having said that, Daniel has been, as he can, plugging in information as he, does an inspection or receives a complaint, but we're well behind the building division. And that's a pretty good example, because if somebody goes to build a deck, I don't know where I heard this before, but it works pretty well. But if you go to build a deck and you're going to be outside, you need a dumpster permit to tear apart the old deck. And the dumpster permit comes from health. And you might, if you're going to be there for a while, I'm not sure what the guidelines are yet on the porta potty permit, but that comes from health. So you go to the building inspector, you ask for a building permit to build a deck, and they say, sure. Now go to health and get your dumpster and get your porta potty permit. And this all can be done in front of our very eyes through our permit sharing software that the town has and I'm being trained on. Daniel knows something about it, but he's the only one in the department, and he's just doesn't have the level of confidence right now to make decisions across the board. And I see that as being, the future role that I will be playing is to mentor him. I hope he's happy to accept some more responsibility. We got to determine that first, but to mentor him through that. But under the heading of environmental health, I should be able to come during a regular Board of Health meeting and tell you, not in grave detail, but we've had 5 pest control rodent sightings since the last time we met. The question might be, are they all in the same neighborhood, or where are they coming from? And we could have a short discussion about that. The swimming pool season is here, so we're permitting our 32, I don't know how many public or semi-public pools we have yet, but we are in the process of doing that just to keep you up to speed, generally speaking, across our environmental health responsibilities. So I see Daniel, and I'm hoping he's going to accept this. He's been on vacation. I met with him for 1 hour since I've been here, and I'm taking a lot for granted there. So that's lane number 2. In lane number 3, we're going to have emergency preparedness. And this one I'm most excited about, really. I mean, the other 2 I've worked with ad nauseum, for an entire career, but this, we practice with emergency preparedness, that is, and never really got a chance to, exercise, actually implement our training. But here it is. And for some reason, probably locked in the stars, I don't know, Providence, I'm back. And now getting up the curve of emergency preparedness. So I've assigned Laura to staff emergency preparedness. It seems to me, in dealing with her and with some of the folks that we deal with in our command, that she works best with our first responders and our public safety folks. And I think she gets more out of that than trying to juggle, what's going on moment to moment. So fortunately for me and for us, we have Kerry, and she's a resource, a state-renowned resource. I don't know how better to say it, but
No, that's true.
well, let's face it. She's
Yes, it is.
developed curriculum for all us locals over the years. I've never put a face to it, and it took me a long time to tune in. Yeah, that's you, this lady. And I do know some of her colleagues, but through Boston University and their programs to train public health and emergency preparedness, and in other areas, housing and so forth. Well, she's there for us, and she has agreed through the chair. I got permission to meet with Kerry, and that happened yesterday. And we didn't have a handshake or a fist pump, but our eyes did connect, and that's this day and age as good as a handshake, right, Gene?
Nodded.
Connect our eyes. No, you got to get a little more than just a nod. Hi, Paula, by the way.
Hi, Paula.
And so Kerry is going to meet with Laura at a predetermined time that's mutually convenient. She will get information from Laura and report out during the segment of our meetings on emergency preparedness. And so tonight you heard me talk about 3 different lanes. And I just breezed across them because this is our first meeting, and I just want to give you the overview. I could go back now and talk about the nurses report if there are any questions. But I see us either on a monthly basis, Rick, or however frequently you want an update, but it would fall into one of those 3 categories. Epidemiology, environmental health, or emergency preparedness. Everything else will come under the director. If there's administrative stuff, if there's, budgetary things, and let's face it, I got 10 days. Rick has 100 days. I think I'm 3 weeks into this, but Jean is right there for us. And it's amazing how much this lady does. She told me the day starts at 4:30 a.m. and it's, I don't know when it ends, but she's on top of everything. So we're real fortunate to have her as well. I think that's the overview. The only other items that might be of interest, and I prepared for these, but I really would like to tone it down quite a bit, and I hope it's okay, is these permits for outdoor activities. And Paula, I get the feeling from sitting in a little bit here and there that this was, kind of a, specialty item of yours. But I mean, it's come to my attention, and someone put the halt sign up if I'm going too quickly here. But this is an administrative task that needs to come to the board for purposes of information. And I can fill you in on what's going on. And if something is peculiar, and I do think there are some really important pieces of this, things that we're going to learn about, and I'll get to that when I get to the Ewald application. But for the most part, why don't you let us at the administrative level review them, respond back and forth with the applicants until we're satisfied that everything is in order. And then I'm happy to report out. And if you have questions, by all means, you can, rattle me if you can, catch me by the tail and see what I did do, or if I did something that you would prefer. Otherwise, we can tweak as we go along. So I'll just ask for, if anybody has something there, looks like
Sounds
Carrie's
like
got
Carrie.
her finger up there, or thumb,
Yeah.
whatever it is.
Kara's got her
And,
finger up. It's my finger. Yeah, my light bulb is kind of glowing up there.
Yeah, nice.
Yeah, I mean, because I was involved in the review of the permits before Paula took it on. Thank you, Paula, because it was a lot of work. And I think I told
Yeah,
Bob
it was.
a lot of work. I've told Bob this, and I don't remember who else, but this was something that, while I certainly welcome not being part of the administrative processes, I was reluctant to do so until I understood what the administrative process was going to be, and that, we were clear on how things were going to work. Because there were discrepancies of different things. The guidance was changing frequently, and there
Yep.
were sometimes things were interpreted differently. And we talked about this as a board, and I expressed this as best as I could, and the board agreed that it was important that we get some consistency. So it's an important piece, and so I'd love to hear more about how, who and how the review is going to happen.
Okay. Well, then let me back up just a moment and go back to this permit sharing. They call it in Reading. We call it in Reading VPN, and I just call it permit sharing. But I spent my second hour with them yesterday afternoon, and I had to stop. My head was about to explode, but it really gets simpler the more you use. And, applications either begin at recreation or they begin at the town manager's office, but they always come through health for a sign off so that we can take into consideration the COVID pieces. And as you said, Kerry, the COVID pieces are changing, and we're trying to use common sense and stay within the requirements and the guidelines that the state sends us so frequently before approving these things. And so I'm finding the consistencies and just going through these, but there are nuances to every one. And let me please use this, and I hope it's okay to use the UWALD application. And maybe I should have left them anonymous, but it's a public record. And did you have something you wanted to add, Gene? I just saw your hand go this way. Here's an application that wants to have a youth birthday party at one of our parks. And 25 kids want to be invited. And there's 2 dugouts, and they're all going to bring their own equipment, and they're going to play a game of baseball and call it a birthday party for the UWALD's kid. I don't know that name. So in it comes, and well, Rick and I talked through it and said, "Geekers, this is going to be a tricky one." I mean, some of the sports teams at the high schools have stopped, and how do you want to proceed with this? But we did come through a little checklist that has not been formalized yet, but it goes to the point where, lady, I need the name of every person that every one of your guests and what school they go to, so we can do contact tracing after the fact if we have to. They need to, and then she regurgitated the COVID guidelines by saying they're going to stay 6 feet apart. I don't know how you do that in a baseball game when you go to tag somebody out. They're going to hand sanitize frequently. We'll see about that too. And I mean that literally. I'll get to that in a moment. And they're going to bring their own food. They're going to wear masks the entire time. So that's all in writing from them saying, we're going to do all this. And I added, yes, and I want a guest list with contact information. And then I didn't tell them this, but this is what I'm going to do. And I hope the board is happy about it. But Laura has been tasked with going by the site where the activity is going to take place. I don't want her obviously taking pictures of kids in a park. And I don't even want her to confront any of the participants. I just want her to observe for a while. Are they indeed wearing masks, keeping social distance regulations? Because if we don't get this data back, what's the sense of having the regulations? And I mean that literally. We can hand out a pamphlet that says, this is what you're supposed to do.
Right.
Try to follow and stay safe.
Right.
But to ask them to go through the permitting process and not have any kind of feedback, it's like,
Yep.
why are we bothering with that? We don't even charge for it.
Yep.
So it's a lot of time. And I mean, I'm big on, who do we bill for this task?
Right.
And it can take some time. So that's where we sort of are in this thing. I think there are going to be some nuances on each and every one, but I'd like the feedback of the board on the idea of, let's use some common sense. Let's look at them individually. Let's use the guidelines the state offers, make sure they put everything in writing ahead of time. And we're applicable or appropriate. Now we have another one on the desk. I haven't reviewed it, and it would not be sensible to have the folks that want to do some kind of a gathering. I think it's across from Town Hall at the Common in a couple of weeks, to ask them to have a sign up slip.
Right.
It wouldn't hurt to have somebody observing to find out, are our people getting, and if they're not, why aren't they getting the message? That comes back to us. We're not effective in getting it out to our people. You can't ask the state to do that. I don't believe that's the state's responsibility. The 351 cities and towns own the responsibility of getting the folks that they work with or live with to do the right thing as best they can. Well, that's where I'm coming from.
So,
Go ahead.
so let me just say, Peter and I had talked about the process, and I think that what I was thinking was, as Peter just sort of outlined, is that the health division under Peter's direction, reviews these as they come in, has the dialogue, makes sure that they're following the guidelines, and then informs the board, maybe in the pre-board packet, that this is, we approve this one and this one, using that form, with any commentary. And really, I think the discussion at the board would be if there are either gray areas that, Peter's not sure of, and we should have a discussion about and make a board level decision. And frankly, if Laura's visit on Friday or Saturday when this game happens, if she finds that there wasn't follow through, we need to hear about that and think about what does that mean about, our approval process and so forth. So, I mean, it would be those kind of things as opposed to us having to review every single one. But, having a sheet that, and they seem to be less now, I think, because the weather's colder and so forth. But, having a sheet and just kind of being aware of them and weighing in when there's controversy or decisions to be made. So that was what we had talked about.
Well, if I can continue just for another moment, and then we're going to move along, but this is an opportunity, really. If we had enough lead time, we could be proactive. And I'd ask if you had thoughts about this gathering going on across from Town Hall. And I'm not privy to, well, I guess I am. I just haven't gone up to speed on numbers of people that are going to be there. I mean, what are you happy with? I'm not into being a social distancing cop or a mask cop. But how do you want to take this? So we can observe it and come back and offer feedback and say we need to improve. That seems to be the model out there. We get pictures of how poorly people are behaving.
What kind of a gathering is it, Peter?
It's going to be, I think it's a high school group, and it has something to do with sexuality, and
yes,
it's going to be for a couple of hours. I think it's early.
The
not in the evening.
Breonna Taylor.
No, I'm not sure, but it's barely been discussed.
I think it's a Friday evening upcoming, and it's a countrywide, if you will.
Okay.
Event.
It's about victims of sexual violence, including transgender.
Okay.
So does
Thanks,
this
you guys.
fall under political expression? Or is this a vigil?
That's one of the hard questions.
Right.
We've been sort of advised to treat things broadly as political, and those are not regulated.
Right, exactly.
That doesn't mean there shouldn't be advice given and followed,
Yes.
which we
Yes.
do.
Right, no,
And even a follow-up process. I
Yeah.
mean, if we can get some data, what happened there, we say, gee, 'cause we can't stop you from doing this, but you're going to see rates go
Right.
up.
right,
If this behavior continues, now, come on,
right.
or however you want to word it.
The permitting process we had when things were nice and quiet and sleepy did not imagine a lot of the things that are happening now.
Mhm.
I don't even remember seeing permits, which is why how slow they were, and
Right.
certainly not from high school students. And
Right.
I will say the high school students one are generally speaking, are very thoughtful. The most difficult issue they and most organizers have is how large will it be? Nobody
Because they
knows.
don't know.
It could be 20, it could be 2,000. There's just no way to know. So, we try to put them in touch. We actually had a Zoom meeting with both chiefs, myself, and one of the organizers, just to sort of make sure they felt welcome and felt like they could approach us at any time for any kind of advice or information. And I think the organizers appreciated that. But we're all kind of learning together, I guess you'd say. And not a lot of paperwork is going to help some of the things that are going on.
Right.
So we just kind of do the best we can.
Kevin,
I think a feedback loop is always good.
Kevin, did you want to say anything? You're on mute.
Yeah, just a couple of points, just to go back to the permits and the process, Peter. Is it going to be you that's going to be reviewing all these as they come in? Because I think that's, what I envision as part of your role as a director, to specifically get them off the board's table for two factors. One, you're much better apt and to handle the fact that things are changing on a regular basis, and you're going to have to update how these permits get handled from a health standpoint. And also, it's a single point of reference that is an employee that can handle these things in a more timely manner for the person putting in the application. So, big long question to say, is it going to be you?
Yeah, there's a short answer. Yes, it is. But
Okay.
I would elaborate just enough to let you know that the very first thing I think I learned here from Laura was that the board wants to do every single one of these. And that's what they told me to do. And that's what I'm doing. And my first order to her was, give me them all. That's not how it works. So they come directly to me now. Laura pitches in. She reviews them. She's familiar with it, and she offers some comments, but they're going to go through me. They'll be in my packet to the board on a regular basis whenever we meet or whenever you want it. And if there are questions, I'll dig out the answers between recreation. And I've already begun developing relationships with those folks and all the folks at town hall, not all of them, but the important ones that work administratively for Bob and so forth. And we're going to get this together and be as fair as we can about it. Now, will there be a time when I'm saying I'm stuck? And I kind of was, and Rick and I talked through it. We used what we know about public health and disease control, infection control. And, this is, to me, what it's all about. It's not about state guidelines. It's about, a knowledge base that we can count on to protect our community. And the state is there to offer us assistance. But really, we're supposed to know how to do it ourselves too.
Okay, yeah, I mean, that's kind of how I envisioned that going as well. And just, I know, Kerry, you want to chime in, but just real quick, in regards to this event that's going on, it's going on Friday or Saturday? So I just want to make sure that those folks know that the governor, they're going to fall under that outdoor mask order rule that the governor has just put into place, which starts at 12:01 Friday morning.
Yep.
So
Kevin,
make
it's
sure that we
actually
reach out to them.
It's an upcoming Friday. It's not this Friday.
Yeah, it's not
Okay.
tomorrow. It's not tomorrow.
Oh, who knows? Could change by then.
Yeah.
Yeah. Carrie, do you have a comment?
Yeah, just 2 points of clarification. So I'm glad to hear, Peter, that it's you that's going to be reviewing. It was my sense that Laura was taking this on with other things, and that was my question about who and how the review would be done. It was never, it was the board's desire to have the material reviewed, absolutely, because we wanted to know that the state guidelines were being followed and applied appropriately. And if you're going to tell us that that's something that you're able to take on and handle well, then that's great. It was never my intent. I don't know. I don't think anybody else on the board had this thought. But it was never my intent that this be something that the board be fully embroiled in. We just felt that there was a challenge in terms of process and in terms of application of the guidance. So, if you're saying that you're taking that on and that, you'll be applying those guidelines, that's great. Thank you.
Laura still has a role to play in it. And I expressed earlier, which one of the things she's going to do, but it's mostly, let's manage some paperwork. And then there's the risk management as well. And determining how to manage that risk is tricky. And I have Rick, he's an MD, and I have you guys in case he says, gee, because this says a lot of wiggly areas. Let's bring it before the entire board and get a feel for it, because, we don't want to stop making exceptions and then have that come back to bite us a month later when someone else, you let these guys do it this way, why can't you let us do it? So we do want to
Peter,
have some consistency.
It sounds like we can expect you to be fully accountable for this process.
Yes.
I had one question just on environmental, which is you mentioned about Dan working with IT around this software system, permitting software system. So will this system allow us to get better monthly reports about numbers of inspections that have been done, numbers of re-inspections, all the kind of stuff that I think we've all been frustrated that we don't want. We want some level of detail to feel comfortable that they're happening. One thing I use, for instance, is, if we have 130 food establishments and they need to be inspected twice a year, that's 260. It is now November 5th. There should have been probably 200 inspections so far. Can you tell me like that from your data that has been done? I'm sure you can't. It's rhetorical, but will that allow that kind of information?
That is a yes answer.
Okay.
Great.
It's give us some time. That's the only thing. They're not ready. Our permits will be sent out automatically and returned because they have to be renewed every year. We should be able to get our fees, check into the new, they already have it on deck, all the different compliance points. They even have iPads for health so they can do the inspections, and in the field, they can find violations or discrepancies and it would get locked in so we can break it right down to, how many places do we find, time temperature abuse or what's up with refrigeration? Or there could be trends, but food safety is like, it's taken a back seat to other infectious diseases that we are dealing with every moment now. But yep.
Good. Any other comments, questions?
Well, I feel remiss around the nurses, but you got that so you can just read through it. If there were questions, I would try to handle it. But later in the agenda, I'll bring up the most recent information that Christine sent to me this morning. And again, this is the best way to leave, I think, is to say that, she's somebody we can really count on to give us, she's just in so deeply with everything COVID right now. She has all her connections in place and she eats, breathes, and probably sleeps COVID and is enjoying, I would say to some extent, I've asked her to burn out, but she actually enjoys feels the juice coming from, this is really public health.
Great. Carrie?
If I may, sorry, yes, I'm
Yeah.
happy to move us on, but I just, you reminded me, Peter, that at the Mass Health Officers Association conference, which just concluded this week, they traditionally issue awards every year for different areas of performance in public health. And this year, the Mass Public Health, the award issued by the Organization for Public Health Nursing was issued to all public health nurses throughout the Commonwealth. And all of them will be recognized. They'll all be receiving a certificate of acknowledgement. And there were some lovely remarks about, the dedication that these folks have shown throughout this pandemic. And I just wanted to acknowledge that and thank Christine and her colleagues who have stepped in and done some public health nursing for us. And say thank you for Christine's report as well. But I wanted to make sure and share that
Yeah,
information.
that's good news. Thank you.
Well
That's great
deserved.
news. Yeah,
Yeah.
well deserved.
Yeah.
All right. Next, Bob, do you want to take it away? And
Sure. First, before I forget, the board is most welcome to attend individually or collectively. November 17th is the next select board meeting. The chair and I discussed earlier in the week, we think it's time for a longer command update, if you will.
Mhm.
And Greg Burns and I, the fire chief and emergency management director, and I have talked about it. And we think at least in the packet is going to be a refresher on the incident command structure, because it's been 6-8 months since we went over that in public. And it's really time to sort of remind the community we're in a, in a serious situation and organized to handle it. So I don't know that a lot of that will be discussed at the meeting, but it will be in the packet. But again, all of you are most welcome to come. And likewise, if it's ever helpful for you as a board, any or all of town staff can visit you at one of your meetings. So if you have, specific issues and you want the fire chief or the police chief or anyone, just please feel free to reach out and ask. Communication is always tricky, and during a pandemic, it's that much harder. We've all adapted to Zoom in a lot of ways, but there's some unspoken poor communication habits we're all getting into because of it. When you don't see people in person, it's really just not the same. So tonight, I just wanted to take a few minutes of your time, and I appreciate it, to ask you for something that you shouldn't want to do, which is to let the public back into town hall. I sent you an email that Peter was kind enough to forward, and really don't want to dwell on a lot of what I sent you. Most of the background pages are for that, is for if board members wanted more background. And I know there's going to need to be more detail provided to you, which we'll do through the command structure. But we did discuss this Monday, some of the preliminary thoughts on opening town hall, and I included them on the second page. And I can share that if it's helpful as a document right now. Why don't I do that?
Jump in and make a public service announcement. If the full board does plan on attending the select board meeting on the 17th, please let me know and I'll make sure you are posted so we are on the right side of the open meeting law. Thank you.
So right now I'm sharing page 2. I think that's the meat of the discussion. And I want to leave you tonight and have you think about this, and then I'll obviously be happy to return or proceed any way you like. The long and short of it is we've been able to deal with the general public using outdoors up until now. And a bit of an early snowstorm made us realize, oh, winter's coming a little sooner than we thought. So we're still using the courtyard outside. It's still an effective way to communicate, but we know those days are numbered. And, despite the risk of opening the building to the public, there are some things we really do need to accomplish. I will say, in talking to town hall staff, that list of essential things that the public must come in for is fairly small. I mentioned a couple things in this document. Marriage intentions must be witnessed in person, have historically been done outside until recently or still. And then the assessors need to provide access to their office to the public starting in January for abatement discussions. Other than that, it's really, occasionally one-on-one things, but it's not a big issue where a part of the building, needs to provide a service, at least not in the next couple months. So here's some of the things we discussed at command, and I didn't list them all, but I thought it'd get us started. The first thing we want to do is a big public outreach effort to remind folks how to interact with us by not coming to the building. We've not done that at the request or suggestion, I guess, of a board member over the summer that just said, sort of play this all low key. Don't remind people that you're closed. Don't remind them that they could come visit you. Just let them inquire and deal with it naturally. And that approach has really worked very, very well. I have only received 3 comments over those months. And again, we were able to handle the actual requests, not just the comments. But it's time now that if we want to open the building, we want to really make sure everyone understands, here's all the ways you can deal with us. The second part is if someone, reads the publicity and still insists they want to come to us, we'll have some sort of an application process that will be reviewed by staff with an outreach that will try to dissuade them from needing to see us if that's reasonable. Here's another way you could do this. Did you think about this? Whatever the case may be. Until we get involved with this, it's hard to know how many people are just going to want to come in the building without doing a lot of homework first. But we don't want them here if they don't need to be here. Thirdly, when folks really do need to come to see us, and we've all agreed to that, we need to limit their access in the building and we need to limit their number. So many of our peers, and in fact, most of our peers have gone to an appointment-based system, which gives you a control over who's in the building and how many. And an important element of that I've learned from one of my peers is not to give short time frames for people. If they need to have a 20-minute discussion and you give them 10 minutes, it's just going to ruin your appointment schedule. And I'm sure as the doctor that's present here will say that patients don't like to wait.
Right.
So we want to
But we do it anyway. No.
I always got early appointments. So we want to kind of do our best not to aggravate people and give them a reasonable hearing, if you will. And then to the extent people are going to come in to see us, we're going to extend some of the staff's safety aspects. And we are allowed to require people that are coming into the building to wear face coverings. That may require a vote by the board. The state has made it real clear to me that is absolutely something you can do. Obviously, subject to the same exceptions in terms of here's why I can't do that. But we can turn away people that do not, provide evidence of why they don't wear a mask or they just don't choose to. I'm not sure we want to do that, but we definitely want to have a strong policy. And that's before you come in the building. I sent you late in the day, I'm sorry I missed it earlier, what is effectively the library's policy for what information they capture from people before they are allowed in the building. And that's something I definitely want your guidance on because that policy from the library was from the summer. I think much of it is still good, but I'm going to guess that you're going to want to add some improvements to that. And we discussed some things on Monday at Command in terms of the kinds of questions we would ask people. And I took some notes, but I sort of think between the meeting notes we created and my notes that I missed one or two things. So Carrie, please have another look at that. I know we wanted to ask if people had traveled, if they had any symptoms, they had any relatives or friends with symptoms and so on and so forth. And then on the back end of the visit, we want to make sure to capture their contact information should we ever need to go contact trace. Town Hall has been generally very fortunate. We do have employees that have tested positive. We do have employees, relatives, and close contacts that have tested positive. In all cases, we have had employees that found it out early enough not to come in the building, and they stayed home. So knock on wood, we're doing really well. It's not like we're avoiding it, though. We've had some pretty serious incidents with folks' health, but knock on wood, things have worked out. We know we can act responsibly. There will be a certain fear among employees that we don't know if the public will act as responsibly as coworkers will. So we want to be real careful with that and make sure both coming in and going out, we have the information we need. And then I provided some guidance that I worked with over the summer with a number of people in terms of how the building is staffed. And there's no need to go over that tonight, but you can see we've done the square foot measurement. We tried different approaches and that seemed the most logical, and that's what the library ended up using. And we limited people for workspaces based on that, and had to arrange some people's schedule. Had to arrange some of their, we have a fair amount of staff at Town Hall that don't spend much time in the building. And we had to really keep track of that a little more formally instead of just people coming and going, doing inspections or whatnot. So that, there were really limits. I think generally that's worked out, again, pretty well. The question that we were less clear on is by adding the public into the building. And again, you can go through those floor plans and look at some of the public spaces like hallways and counters. It didn't seem to me that it really provided a jeopardy in terms of too many people in a space compared to how we're staffed. The closest I could come was up in assessors. There's two different rooms they use. There's a capacity of 3 and 2. The 2 usually has 1, sometimes has 2. The 3 generally has 2. If you add a member of the public standing at that counter, to me, that's pretty close to having a third person in that space, even if they're standing in a hallway. That was the closest that I could see, that would cause me any concern at all, at least based on the numbers. And, you haven't had the chance to see it, but the building is locked up pretty well from a safety standpoint. There's plexiglass or whatever it is all over the place. We've just adapted really well. It almost feels like it's not very customer friendly anymore, but that's what you have to do. Town Hall has always been used as a welcoming and friendly public building. It is meant for the public. We just can't run it that way during this pandemic. We have to be a little unfriendly about it and a little bit grumpy about it and say, no, you're not really welcome. You really have to be here. And that's a hard message for staff to twist and do because they're all used to doing it the other way. But I think we do understand the seriousness and, are able to sort of make that change. In terms of, other written policies, we have some draft policies, but I didn't want to go too much further until I just showed the board these preliminary thoughts. And then I got a sense from you of how you would like to proceed. I can keep visiting you, command can visit you. You can delegate this to one of your members to discuss with me and or command, whatever your pleasure is. My sense is we're going to want to open the building to the public with your permission sometime this month in November. Honestly, I don't think it's critical that it be before Thanksgiving. But sometime, shortly after that, I think would be helpful. We're still able to deal with individual requests. And we can always find a meeting space somewhere else if we have to. We have been using the police station community room, which has a very large capacity when we've had to interview candidates in person for jobs, for instance. And that building was not quote unquote closed to the public. It was just the public was discouraged from using it. And then the last point I'll make tonight that I shared with command and especially with the select board chair on Monday was based on this square foot analysis. There is no way that a public meeting can be reasonably held in this building under the current sets of rules. The select board capacity is 8. Their membership is 5. Normally there's 2 staff members in there, 7, and then there could be 1 member of the public. And that's not a public meeting. And then next door, where the finance committee often meets, and they are 9, the capacity is 4. And then there's many other boards that use either of these rooms. None of the board sizes are conducive. You couldn't use, again, 5 of you could meet in the select board room. You could have 3 more people total, between staff and anyone else. The Board of Health, I don't know if any of you, other than Kevin, have been on the board, but typically you meet in the burger room. The burger room capacity is less than 2 people, by these measures. Yeah, Kevin's putting up his hands. So the other part of this is, and there hasn't been a big cry from the public about, having public meetings back in spaces, but it would be of great benefit because it is very hard to have some of the public discussions without the public physically present. But unless we just move to a school location or a very large warehouse location, this building is just not going to provide that, for the foreseeable future. So again, I welcome your thoughts. I welcome your questions. I don't really expect them tonight, but I'm certainly happy to stay for them. But again, share your thoughts and share your approach on this, any way you like. And Amy, I discussed with Amy the library situation. If you ever want to revisit what the library is doing, for instance, they are open to the public on a limited basis, much as we would sort of propose to be. That can also be arranged. I will say that the demand to use the library from the public was 100 times higher or 1,000 times higher than town hall. People, for a lot of reasons, loneliness and other reasons, wanted to use the library. Lonely people generally don't come to town hall. There are a few exceptions, but they have much more interesting places to go than town hall. So again, we're providing an essential service. We would discourage anyone that's less than essential to be in the building. But we do know that we are going to have to find another way to deal with some of our patrons at some point. And, we'll absolutely follow your guidance and do whatever we need to do, however you decide. There's no question about that.
So I guess the question is, one of my questions was going to be time frame, and you answered that and said you didn't think it would necessarily have to be before Thanksgiving. And one way to go about it, since the document you sent was 15 pages, single spaced, and I don't think many of us have had a chance to read it through it. One way to do this could be to have individual board members review it and send me or Peter or both comments, suggestions, concerns, whatever it might be based on that document. And we could pull those all together and either have a meeting with you, Bob, before the next board meeting, or send you the collection of concerns, questions and so forth. So you have some time to kind of either respond or think about it, and then maybe have you come to the board meeting on November 19th, and we can certainly include what those issues are in the pre-board packet, so all the board members can see it and know what's going to be discussed. And if you want to respond in writing, or if you want to just come to the next board meeting and we can go through and have that discussion. It seems like that would be timely enough for you in terms of opening up town hall. It would give you some heads up to be able to think through some of the questions that might come up. That would be just one way to do it.
Yeah, Rick, I would say that if board members can send back individual comments to Peter sometime in the next week, that would give me ample opportunity to have a discussion with each one as I need to.
Okay.
And in advance of the 19th, I'd get you information out a lot sooner than I did today, because the 19th, you may be in a position to vote something.
Okay. That sounds good. How do other people feel about that?
For me.
Works.
Fine for me.
So folks would then read through the document, get any of these questions or concerns to Peter by the 12th. That's a week from today. And then Peter can work with Bob and Jean to kind of put that document together, and we'll plan to have Bob come 2 weeks from today, and we'll have that discussion we'll go through the items. I actually did have a chance, because I'm retired, to look at this document when it came by, and to compliment you on the work that's been done. It's been pretty extensive. I think it looks very good. I do have some comments, but I'll share those. But overall, it's pretty impressive.
Thank you. If you would also copy Jean and/or I, just in case technology doesn't always behave, that would be helpful.
Sure.
Not just Peter.
Okay. And anything else on this? I had one question, Bob, just about when you were here last time, you talked about the budget process in some length. Um, and I thought we would, I'm wondering how we connect with that process and you in terms of what kind of resources the division might have. We talked about the fact that, you know, we have the advantage of having Peter here to have sort of a fresh eyes look at things. And so that is true value. But we won't have this formal analysis done until early next year, which will be too late in the process, as you described. So how would you suggest we might think about that?
Yeah, that's a really good question, and the answer is not easy. I think the best way, given where we are, I think the best way for you to approach is to work with Jean and Peter and form some sort of a budget request. And it'll be done with imperfect information, and I don't know how specific it really needs to be. But you could outline types of positions you would like, amounts of positions or hours you would like. And I know it's not great to sort of front run your study, but there has to be something generally presented. Jean will make a presentation of the select board probably on December 9th, which is a Wednesday, possibly the next week. Those 2 weeks are saved for budgets. And that presentation is, if you will, a department wish list. So it can be general. It does not have to be exactly explicit because it does not have to be balanced. So it can just be whatever the department, would like to see. And again, with funding you're getting this November for staffing permanently and then temporary to do your study, you already have money to work with that's over and above the current staffing level. So one of the first things you should do is think about, for the inspection and the nursing hours especially, are we adequately staffed? Would more hours be beneficial? And I think you need to think about it both in terms of COVID and after COVID. And I know that's hard, but you should focus on COVID. I mean, that's where we are. That's what we're dealing with. If next July, all of a sudden, we don't have to worry about COVID, that's a nice problem to have. And then, I know the board and past chairs have expressed an interest in a full-time health director. So I would assume that would be, in the discussion. And again, work with Jean. I'm happy to work with you also, but the timing is not ideal, but it's okay. I think the community will understand. Certainly the board will have no problem with a less precise presentation in December. They'll totally understand. I think the finance committee, they were supportive a month or so ago with, my vague description. They will see a budget out of me sometime the last week of February, early March. So I don't know how that'll tie into your output exactly. The one thing I do want to urge you is don't rush your process. Make sure the process is good. Honestly, if we have town meeting in the last week of April and I have to stand up in the last week of April in front of town meeting and make a lot of changes, I'll do that. I'll say, the health Board of Health and the Health Division have got these thoughts now that weren't quite ready in February. I have no problem with that. And I don't think any town meeting member will have a problem with that. If you develop thoughts after April, May, that's a little harder. Because the budget that town meeting sees is theoretically meant to be balanced with specifics. Here's how we're spending wages, here's how we're spending expenses. And if the board is just not in a position to be specific by that time of the year, I'll work with you. Again, we'll just do the best we can. A pandemic has to create flexibility. There's just no question about that. So, I'd say in a normal year, I would want you to be ready in another week or two with suggestions to Jean. This year, it doesn't matter. Do what you need to do. And I'll certainly have you back.
It does occur to me that one comment that Peter made about where we are in our routine inspections could be a data point for justifying more resources. If we're woefully behind where we should be, that would be real data.
Yeah, and as Peter would find it helpful, I'm happy to join a discussion with he and Jean on any of this, or stay away, whatever you feel most helpful. But I think my approach sounds like it's a lot like yours, Rick. I kind of like to be organized. I like to see things visually. I'm not real interested in conversations compared to that. I don't want the story, I want the facts.
Right, right. So, so should we have this as a board agenda item it'll give people a couple of weeks to think about not only what we might ask for, but like the number of inspections completed, or what other facts could help support, what we would ask for that we're missing. I mean, I think we could do this collectively in a board meeting in one agenda item. I don't think we need to do a whole lot of pre-work before that. Any thoughts about that, or?
Yeah, I'd agree with you, Rick. This seems like this is an X's and O's kind of thing, and it doesn't even have to be that specific, as Bob was just alluding to. So I think this is okay. Where do we see the needs here, and what is that going to look like from a cost standpoint? And then you can come up with a number that you can promote to the select board and FinCom from there.
Okay.
Yeah, and I just want to add, I sat through the last sort of Board of Health staffing review done by a consultant. I can't remember, you'll probably all know, but it's about 5 or 6 years ago. And the thing that, I don't know if it's anyone's fault really, but the thing that did not happen was the whole organization was not involved. There was a very narrow look at what the health staff was, with complete absence of, we had an anti-substance abuse effort in the police station, lots of mental health expertise in the schools, of the nurses. So I do want to encourage you to take the broader perspective. And along those lines, if it's at all helpful for me to ask the schools in the town to give you an opinion about what you do well or badly, I'm happy to do that. Where they see shortcomings. They won't see many, quite honestly, because what you see and what they see is quite different. Carrie will be more familiar through command with sort of how we see it. And it's not the day-to-day community stuff that the town would really have a lot of opinions on. But generally, as many of you have seen, our staff works really well with the schools. I mean, the school nurses were invaluable over the summer. Not every community had that relationship. So we just want to impress upon you that the whole organization is here to help you, as would be helpful.
Great. That's helpful. Thank you.
I just, if I may,
Sure.
Rick, yeah, just I would be interested, for one, if there were some data points of information, feedback from staff about things that they see. I think that would be helpful. I'd be interested in hearing from Peter, and just some data points. Don't need a lot of information, but yes, that would be helpful feedback, because from even participating in command certainly does give me I get a little different insight, but still we're still outside, and it's hard to know. We get kind of a glimpse in, so I would find that valuable if others do.
So Peter, maybe
Absolutely.
that could be included in your report, that you send out November 17th, 2 days before if there are any detail around what the staff feel.
Yep.
And any other facts that could be helpful supporting or looking at how we might need more resources.
Well, is it appropriate to comment now? And if nobody shuts me up, I'll just keep going for a moment here. But if we're building from a bare bones, then we can talk the nuts and bolts of how many inspections, how many inspectors. There are models that we can draw from some of our professional organizations that'll help us put that together. But really, we're at a tip. Well, I think we missed a tipping point. I'm struggling here with words, because it's an opportunity to really be visionary right now. We and local boards in Massachusetts have traditionally been infection control, and it's a big deal. I mean, the Merrimack River was drawing their drinking water from the same place they were putting in their wastewater, and that was 120 years ago. They didn't have a clue why there was so much disease up there during the Industrial Revolution. And you know, we still work with the basics on infection control, but now it seems as though with this COVID, there are more things, and we've been talking about it. It's always been on my plate. We just never had the time or the resources to kind of make the shift into the behavioral health issues. I mean, I see our society finally really coming to grips with substance abuse, the way alcoholism was reached where, you know, a point where we're doing as much as we can for those folks. I mean, we still haven't come far enough. And so working with the schools, Bob said, I got to start to ramble here, but I would like to try to motivate the board to think more visionary than just your inspectors and inspectors. You know, the nurses do things, and there's all kinds of sub categories within nursing, and we can start to look at that. And I don't know if that would be of interest to you folks in Reading. It's an interest to me as a global perspective in public health. You know, vaccines come a long way, environmental health come a long way with our clean water and so forth. But I mean, we're places now that we don't have a clue about. I mean, ask someone if there's any developments being made for a vaccine against certain forms of mental illness, including alcoholism. And they look at you funny. So, I mean, you really have to think outside.
Yeah, I mean, I'm hoping that when we do a community needs assessment in the first quarter of next year, first half of next year, that's where those issues are really going to come up, and we will want that broader vision for sure.
Okay.
Okay, so the plan.
Every once in a while, I get a chance to get that kind of stuff off my chest, and I can go right back to the nuts and bolts after that, please.
Just to wrap up on this piece, so the plan is that by a week from today, board members will have a chance to review what Bob sent out, get to Peter, CC Bob, and Jean, comments, suggestions, changes, and then Peter, if you can kind of pull that together, work with Bob, and then Bob will come to our next meeting and we'll go over the responses and those issues. And then in terms of the budget piece, you know, Peter, if you can include in your pre-board packet the kind of information we talked about, that'll help prompt, and we'll have a budget discussion also at our next meeting.
If you can get money to develop a vaccine for bipolar.
Wouldn't that be a wonderful thing?
Yeah,
Boy,
That
multi-million.
would be wonderful.
No more depression. We figured it out. Okay.
Yeah, and I assume the board, when you do your assessment, you're going to be looking at, I don't know, I'll say a 5-year plan. You know, not things all to be done at once. Yeah, okay.
Right. Okay, so we're going to move on to the COVID-19 updates, and why don't we start with any incident command updates, and then Peter, we can talk more about current COVID issues and so forth, cases. Carrie?
Thanks. So it was a pretty busy meeting, and Bob and Jean were there. So if I miss anything, I know they'll hop in. There was a fair amount of time actually spent preparing for the presidential election, which went off as far as I know. I know there was maybe some little bit of activity there, but it seemed to go off okay. There was an interesting question raised about whether you can vote if you are quarantined or if you are ill. I was able to confirm that. I don't know that we did have anybody, but yeah, it came up. There's a Santa holiday thing that the Chamber of Commerce is proposing to do. It's the last Sunday in November. So I guess this would be, it wasn't said, but maybe it's in lieu of the traditional holiday lighting gathering that Reading has on the green. So there weren't a lot of details on that, but that was Apparently it's been floated, and we'll be finding out more. And then we did, as Bob said, talked about town hall and opening, and what might considerations be. We had some conversation about preparations for vaccine distribution. There are plans in play through some different things, working with Peter and others. We're able to access the most updated emergency dispensing site plan. That's something that the Department of Public Health works with communities on annually. A lot of different things happening with that. I was able to connect myself and have the opportunity to attend a portion of the regional meeting for the emergency preparedness region that Reading belongs to today, and that they meet the first Monday of the first Thursday. Today's Thursday. They meet the first Thursday of every month, and Laura attends regularly, but I asked if I could attend as a public meeting. It's posted, anyone can attend. So that was good to meet some folks, hear some things, and hear where they are on deliverables. I'll stay abreast of that.
Thanks, Kelly.
Let's see, there was another lengthy discussion about food distribution that's happening at the schools. And what we learned is that the schools are really running a feeding program. Jean was there, we did a little site visit. Is that Tuesday? Wednesday. Wednesday, yeah, we did a little site visit. So there's food distribution that happens Wednesday afternoons at 2:30 and Fridays at 11. And there are approximately 125 families that are served, and they get some different foodstuffs from different food sources. And it has been mentioned before in command, but what became apparent during our meeting was that it really was becoming a big planning issue. I think Chief Burns said it well. He said when Gail Dowd was the one who presented on it, and when she finished, he said, that's actually about 14 planning issues. So it needs to go to the planning section. So let's, have a look and see how we can help you. It was quite impressive. So that was part of the site visit. The planning group went to see it in action and ask some questions. And I had a chance to wander around with Chief Jackson and see, how things are stored and so forth. And we had public safety there looking at, and fire safety there looking at numbers of cars and queuing and so forth. So it's actually it's a very impressive and large organization that they have been pulling off. And we met today, the planning group met today and kind of reviewed some things that can be done to address their concerns immediately, make some quick changes to reduce queuing issues, to try and speed up distribution and the like. And we'll keep talking. There's also a home delivery portion that is happening for folks who either don't have transportation or who are either quarantined or isolated. So as those numbers go up, that will increase. So there's a lot of conversation about how to assist this. And I thought the meeting that the planning meeting today was a great meeting. They solved some things very quickly. I feel like this is this will continue to be an issue if cases go up, as numbers of folks quarantined go up. And as we know, unfortunately, as employee layoffs continue, things like that, there's a need. Now, and I should clarify, this is food only for students. So it is money it has to be delivered at the schools. It's only for students who attend the schools. It's not for adults. So families who may have need for more would need to go to multiple locations. This would be one stop that they would be making to feed their families. So there are a lot of complexities in the family's needs. But it was a very good thing that Gail raised it with command. She, I think, felt a little sheepish about it, but it was absolutely the right thing to do. And they've been doing a lot of work. I'll say it again, we are well served. So a lot of talk about that, and that goes to goal 3 for the COVID responses, aid and assistance to residents in need. Kevin Bowmiller, who's Elder Services, was there as well. And we talked a little bit about, are there needs for other folks in the community? He's just finishing up a survey, I think, that will have some information for the community about what people's needs are. He said preliminarily, it appears that the food right now does not seem to be a concern. Hoping that continues. And discussion with the schools where they are in their planning. Things are a little complicated because of there are 6 cases that came up over the weekend, and John Doherty mentioned that at that point on Monday there were 80 students from the high school who were in quarantine as a result of the 6 cases. So how that has further expanded, I'm not aware, but that's an indication of how, as we know, how quickly this can expand out. So youth apparently have a lot of contacts. So there are 80 students who are all quarantined, and hopefully they just pass through that 14-day period and they stay healthy. But with that number, it wouldn't be surprising if there were another few cases. We'll see. So they did say they canceled sports and extracurriculars for the next 2 weeks. That was starting on Monday. I know that was met with a lot of different feelings. I think it was a difficult decision, but that was their approach. And I think that's all they did. That was all. There was some discussion about how to access testing sites. Because there were folks looking for testing. So we talked about maybe remember to use the Stop the Spread sites, that those are available free, and they're apparently challenging wait lists if you're trying to go to a private practitioner, or if you're trying to go to a walk-in medical center, that folks were finding it challenging to get an appointment. And so it was a good opportunity to remind people that the Stop the Spread clinics are available. We looked at the website and reminded folks to access that. So
Great.
that's all I had.
Thank you. So that's actually a good lead in, that the extra COVID cases. Peter and I talked a little bit about Austin Prep, but this was at the high school.
Yeah.
And I think I read, was it like a girls soccer team or something?
Yeah.
So I don't know, Peter, do you have more information about all that?
I don't. I was at the same meeting with Kerry the other day, and I heard Dr. Doherty there talk about this
Right.
and so forth. So I really don't. Most I can say, and I hope this suffices, is that Christine is working with the school nurses. They work, and so here's part of this report that just came in to me at 2:45 this afternoon. That the number of cases continue to rise. But for this week, from 11/1 to the present, that was just the last 4 days. There's been 5 came in today. There's been 11 in the last 5 days, and 5 positive cases came in today. Maven report runs 402 cases since the beginning, and I'm not sure what that number means. Truthfully, it compared to other communities our size, I just can't. But I haven't had a chance to get my head wrapped around all this stuff yet. But there's some raw data for us. But looking at the bigger picture here, this Contact Trace Collaborative, and it's called the CTC. Our public health nurse is working with those folks on a daily basis, and they have weekly meetings to discuss the contact tracing and our needs. This always seems to be a big question: are we able to handle our own contact tracing? How are we doing with that? I mean, that's key to controlling this. And the setup statewide is that do it yourself, cities and towns, but if you get stuck, we have an organization that you can tap into, and they will provide resources to help us do that. We have not needed CTC yet, but we're close enough to them that we will know how to put them in action if we do get to that point. Back to the Austin Prep, there's 15 cases. Only one is a Reading resident. And their school is closed except sports stopped, except there's all kinds of exceptions. Everybody's looking for ways around this and still trying to be responsible. The golf team, for example, is that really a sport that needs to stop? There's no close contact. And so they ask, for some thoughts from this office, and we're happy to toss it around. They do have a board at Austin Prep, a medical advisory board, and he uses them. But let's face it, when you're working with data gaps, and then you start adding additional concerns in, like, you got to keep kids active somehow. You find ways to, I don't know, to make it work. Let's put it that way. I'm not giving permission to do anything that's outside of the guidelines, but they're getting creative as can be. And I don't know how the school system is doing it, but we got to think in those terms as well. Because I'm not sure how creative we're going to have to be. And it's all about infection control.
Carrie?
So that's the Austin Prep piece. The public schools, she's working, and I mentioned that already, with the school nurses and the contact tracing. We have a head nurse, a name to that head nurse, and she's working with the school system. And they're even talking about if they have to set up a mobile testing site, they're getting preliminary information on how to do that. This one might, I'm not sure if it will come up or has come up, but Christine asked if we could consider putting up a message from the Board of Health on the website, reminding people to stay vigilant. And I think the messages are out there. I mean, could we always use an extra one? Sure. I mean, I was involved with let's reduce tobacco sales. Let's get people to stop smoking. And that's all it is pounding stuff home, but it's a marketing. I mean, it's a multifaceted approach to changing behavior. And believe it, this is a behavior changing exercise. People have to do things that they didn't do before. So another message, I'm there. We could come up with something. Gene mentioned earlier, I think that Peabody has a model that might work okay in Reading. So we'll look at that. And in the meantime, we can come back to that with some comments for you. But here's the last point. More flu vaccine has shown up at town hall. So we have plenty of that stuff. And that actually is something we should have one eye on. I mean, we're in flu season, different than COVID. And so we have been doing it. And I think we have to be one of the last communities to do this much vaccine from a municipality perspective, our own people doing flu vaccine. It just fizzled away during my career. I mean, there were times when we used to do clinics and 1,500 people in one day, and got to the point we're not doing any. We don't want any flu vaccine. Go to the pharmacy, go to your physician. We had this discussion, but we have vaccine here in Reading. I'm not sure exactly how it's going to get used up, but we'll be thinking of ways. And if it means collaborating with another community with our vaccine and some of their resources, well, then they owe us a favor. And this is how you build friendships. Eventually, we're going to have to be working together as a region, I think, and overcoming some of this stuff. So go ahead.
So Carrie had her hand up, and then Paula.
Thank you. And thanks, Peter. And thank you, Rick. So just to go back to your question, Rick, about, I have three things. To go back to your question, Rick, about, anything about the high school spread. So I actually do know from a parent that there was apparently a party that soccer attended with another sports team, and that it was that's consistent with the information that we're getting from the state about overall in the state, that the spread is coming from social interaction. And it's not the case rate is rising for children. It's at 11%, I think was the last I saw, and that is different from the spring. But that it's about social interaction. So we know in this instance that you can trace it back to a party. And that was before Halloween. So just to that, that. as far as the, sorry, just a funny point of interest, Peter, the CTC, you know, when they first
Yep.
came out, they actually were just going to take cases. They said they were just going to do a sweep. They were going to take all the cases away if a town didn't claim them. And local health went cuckoo and said, you can't do that. We want our own, we want to be able to choose that. So that actually it was a switch that the CTC has to be invited in. And I'm glad to hear that Christine is working with them. And they're, you know, we've talked about they're available if needed. So that's awesome. But yeah, that was different. And I have to say with flu clinics, I guess my experience is different, Peter, because flu clinics are kind of still a standby with a lot of the communities that I know. And certainly they don't have the large numbers that you talk about, the 900s and 1500s, but it still has been a pretty active thing. I know even like towns like Newton and Needham and so forth, they do continue to hook in. So, you know, it's not moving out. It just looks different. I think reimbursement is one of the nice ways that is one of the reasons people have continued it. Plus, it's just a nice connection to members of the community. It's a nice way to interact with members of the community, not for a communicable disease or, you know, another housing issue or anything. So yeah, I'm a fan of flu clinics.
Yeah, a good PR.
As you are, yeah,
I used to
right.
call it press the flesh
Yeah.
and, you know, go and stuff.
Yeah.
Yeah.
So Peter, you had asked about sending out a message, and I had drafted one a couple of weeks ago.
I know.
I don't know what happened to it.
Does
Does anybody know what happened?
Yeah, I actually know what happened to that, and it's still under discussion. We've met with, I'm not sure of the players firsthand, but I did meet with a lady named Wellman, and Jean was going to chime in here too, but she got left off the hook. That message that you came up with, Paula, and we appreciate the hard work, but it's almost, and I'm cruising quickly here, so let me get my entire thought out, and then you can come back at it. But seemed like a quarterly report to Wellman. And we wondered if with the dynamics of the COVID as it is right now, there's just so many messages. What do we want to say that the local Board of Health is doing that would be a good message for the front page of our website? And we thought Wellman actually, she's our, I guess she's our expert on the public information. She thought that we needed to get it way down. And if it meant a poster with some thoughts to it, fine. But the press release, the timing was not best for that. And I try to be gentle about it, but let's be clear. There's too much information going down right now. And we would like to be able to frame this up so that what were we doing when we look back? We need a track record on what did Reading Health do the first year of this pandemic, so we can see if, you know, did we do a lot of things right or some things right or anything wrong? And the format that we got seemed like it would fit that really well. So I'm not saying an annual report. I think it would be good for a quarterly report to do it. What has it accomplished? What have we accomplished? So, I mean, maybe I'll put Jean on the spot and ask her if she wants to throw something out, but really she was sort of left out of the loop almost intentionally because we couldn't figure out, you know, a starting point. There wasn't a beginning. I guess there was a beginning, but there wasn't a middle and there wasn't an end to that document, Paula.
What I took from the whole thing was maybe when you started drafting it, Paula, we were in a certain mode, and I think the board was in a certain way of thinking, and then things changed real quickly in the last few weeks. So when Jane Wellman, our communications person, saw it, she said, I think maybe the board might want to reconsider a different approach to this. And so when I got the email, I looked at my colleague from the city of Peabody and saw what they were doing. In my mind, I always recommend a very simple, easy communication piece. If the goal is, and I always say to Bob, what's the goal? If the goal is to instill the point of vigilance with the public, to remind the public that this is not the time to be lax. It's the time to be vigilant about public health and about COVID-19 best practices. So I just happened to be on PB's website and saw that the mayor had a very simple one-page statement that he started off by saying, I want to encourage the public to be vigilant. And it was like, wow, okay. And then it was just a simple recap of the handful of things that we should all be doing: face coverings, hand sanitizer, hand washing, all of the things that we keep saying over and over again, that to us is like a broken record, but is worth repeating the basics of what we should be doing and what we should be reminding the public. So I sent that back around, and Peter and Jane and Matt Cornelis, obviously this has to go through command. So preface that by saying, we're just discussing what message does the board want to give out. But I wanted to maybe bring that back to the board tonight and say, does a simple COVID-19 101, please be vigilant message seem like the kind of thing the board was driving towards, or is this maybe something different?
I think if I can chime in a little bit,
Please.
when I was drafting it, we hadn't started with the uptick, and we were just, the concern I was hearing from people was that people are getting a little complacent and needed to be reminded that, you know, we're not out of the woods yet. And so my thought was just going back and tracing, doing that little history there, just to point out that the points that we are constantly making, masks, social distancing, hand washing, work. And we need to keep at it.
Yeah, and I think that's the major point that we need to get across. And I think there's a little bit more urgency now because of the uptick, you know, and not only the uptick in the state, the uptick in Reading.
Yep.
I think
Reading, yep.
We're still yellow as of the most recent data, but our incident rate is going up. So I think that would be, we probably ought to make comment of that there's increasing cases, and so we need to remain vigilant.
Right.
Bob?
Yeah,
I have one other question.
Oh, sorry, go ahead, Paula.
About the availability of the flu vaccine.
Yeah.
I don't know if anybody else has heard about a lot of places having difficulty getting the flu quad or the quadrivalent flu vaccine for older people. A lot of places have been running out of them, and I didn't know if that was in this batch that you recently got.
I could find out that for you, Paula. I'm sorry, I don't know that off the top of my head. We just got a delivery yesterday, and again, a little piece today. I could find that out for you tomorrow. I can, in fact, I can send you an email.
Yeah, well, it'd be important for the public to know, because a lot of people weren't able to get it.
Send you an email tomorrow or over the weekend. Yep.
And that would be,
Yeah, sure.
if it is that, then that would be a reason to go with the senior center again.
Yeah.
Correct.
Right now, she's doing home visits.
Oh.
I mean, the way it's working, I mean, we're coming up with new models on the fly, and you know, we're doing it by appointment. It isn't like come stand in line the way you used to, and
Right.
you know, talk about things and meet your neighbors and get a flu shot.
Nope.
No,
You know, you come,
Things
you
change,
stay
yeah.
6 minutes, and you
right.
Yep.
next. So yeah, we'll try to come up with a model and get some public outreach on that stuff. And Paula, if I was insensitive in describing what's going on with that piece that I know you put a lot of time in, I try. It's just my nature.
No,
I try to be
fine with it.
I try to be
No.
nice. And I sometimes covered by trying to be humorous,
Fine.
and that works better than trying to be nice. But anyway, we're thinking of you. We spent an hour yesterday talking about how can we fit this in? And then I
Yeah.
think Jean's model came after the fact, and like, where was she during this discussion? We just need a concise, message that is.
Yep,
Okay,
Yeah.
thanks. We're still friends, right?
I get it. Of course.
I didn't hear yes. Okay, there it is.
Bob, you,
No, that came from Kerry. I was waiting for Paula to say, yeah, we're still friends. She's got a time delay. That doesn't count.
I did.
She did.
No, of course
okay.
we're friends.
Okay, good. Yeah.
Thanks, Rick. This is going to put a smile on Jean's face, and it's somewhat off topic, but you'll catch on. Every year, one of the most horrific things we have to do as staff is called an annual report. It's a requirement by the state. It's a document that no human being reads. The last one that did passed away at age 100, and we used to send it to him in Pennsylvania. So I'm not lying when I say nobody reads it.
See those.
And it's hundreds of pages, and it's a requirement.
Yeah.
It's going to be really, really hard for staff alone to write about the pandemic this year and how important that was. So, with all due respect, if you've already created sort of a composite of actions the Board of Health has taken, that would be tremendously helpful for the annual report. We
Yes.
usually don't work on that until February, March, April, and then someone yells at me and I do something in May usually. But it's kind of a dry requirement, but I think it might be a really helpful thing historically to commemorate, if you will.
Yes.
Because you don't know when everything we've done is unfortunately going to be needed again for a future board and a future community.
Yeah.
So that's nothing to do with today. And I think you have an opportunity as a board to really target Thanksgiving with a message.
There you go.
yeah, Kevin.
Yeah. Yeah, just in regards to that, I think it's actually great timing that we're talking about this, and the governor has just put out new orders that you're to wear face masks while outside everywhere. As I think everybody in this discussion probably has seen firsthand or has heard, there's a lot of groups of kids that roam around on a regular basis out together, playing, God bless them, playing all sorts of different things, wiffle ball and pick up football and all these things that kids do. But I think it's probably a good opportunity if we're going to put something out to the public and have and discuss it to, I don't know if we emphasize that as a point, but maybe we work that with some creative wording, which I know Jane Wellman is very good at, into the fray in regards to the governor's new mask order.
Gene, I think it would be helpful if you could follow up with Jane and Peter and try to get something out perhaps to board members next week, for comment. I don't think we need to necessarily bring it to a meeting to discuss, but if you had sort of a semifinal draft and give us 48 hours individually just to comment back and just analyze it yourself and kind of go from there. Try to get it posted or however Jane thinks is the best way to get the message out. Can we do that?
Yeah,
Yes.
we actually have a Zoom meeting tomorrow at 4.
Oh, okay, good.
In anticipation that there might be, some need for us to get going on this. We set that up earlier, so yeah, we'll get that out and get that going. And then it has to go through command and be vetted, so we'll get a draft next week after we get comments back from the board. We'll send that off to command and it goes through that process.
So the next command meeting is the 16th, I think, the Monday before.
We're meeting on Monday. There was a meeting placed, I believe. Is that
Yeah,
right?
we're going to need to meet next Monday.
On the 9th.
Yeah, then
It's
Oh.
added in. Was added in.
but command can review it without a meeting, right, Bob?
Could do it offline. Okay, good.
And next week is a week where it's one of the trickiest weeks of the year because we have town meeting, at least one,
Right.
2 nights, and then we have a holiday on the 11th.
Yep.
So even though many of us work at the Veterans Day ceremony is not public this year, but it's on the common, and many of us
Attend,
involved in it. Yeah.
sure. Okay, so the next, just in terms of wrapping up, for the agenda in 2 weeks, we have the follow-up on the budget discussion, follow-up on the town hall opening discussion. If anybody wants to attend the incident command meeting on the 17th with the select board, they should let Jean know. And we may have a couple other agenda items come up. I had some thoughts about public comment, how to do that, and maybe about the health director report contents potentially. So we'll get you that information in the packet beforehand.
And Rick, can you just recap again what you see as the process for the internal review? I don't want to speak out of turn. I did get an email from Allison. I think we only got one proposal.
Oh, really?
So it could be a short process of reviewing.
What we had agreed upon was that we would have a subcommittee review the proposals, which was going to be, I believe, myself, you, and Bob. Was it Bob or was it?
And Allison, I think.
And Allison.
4, yeah.
4. And then come to the board meeting, which would be on the 19th, and sort of present it. Can she follow up with the other 3 people, and maybe they're coming a little bit late, or whether they decided not to apply? Can she do that?
She can follow up, I think, and ask why they didn't submit, but I think given how we structured this, there was a deadline. I
Right.
think today at 1 o'clock. I mean, I don't want to speak for Allison because maybe there is a way, but I'm not sure.
Carrie, you have a.
I'll just say that I had I did hear from one of the people on the list, and I told him I could talk to him because I wasn't on the selection committee, and he let me know that they were choosing not to apply because they didn't. I mean, part of it was work schedule, but that they also thought that some of our requirements were steeper than were reasonable, and I said, well, doesn't have to be a barrier to application, and we just kind of left it at that. But it was whether or not clients would release their reports if they had other reports from other organizations, had done other reports for other organizations, and would those clients willingly release them? That was one barrier. The other barrier was about the number of projects that we required, I think.
Right.
So I just said that I would relay the information. He did also say that he would be happy to come and speak to the board about some of the issues if that was of interest to people. So I'll forward that information and let the subcommittee talk about that and do what they will. But that was one piece of feedback.
Okay.
If I could offer I don't know, I didn't look at the RFP. I don't know the details. So my comments are general. When we get, one or fewer responses than we would prefer, we feel no pressure whatsoever to just do the best we can with what we see.
Mm-hmm.
You have to set a bar. You have to be comfortable that the bar is met. RFPs can be reissued, and nobody knows better than I the time pressure here. But just please make sure you're comfortable with whatever path you choose.
Thank you.
Okay. Any other comments? I think we're at the end of the agenda.
Was there anything about Election Day follow-up, or did I step on your line, Jean? I just see that on the agenda. Nothing. Okay, sorry.
Sounds like it went off. With all that planning, it sounds like it went off without a hitch. That's good. Okay. We have a motion to adjourn.
Motion to adjourn.
Seconded.
Second,
Roll call.
all in
Rick,
favor?
yes.
Paula, yes.
Carrie, yes.
Okay.
Have a good night, everybody.
Thank you,
See you
Wade.
later.
Good night, everybody.
you.
Thank
Good
you.
night.
Thank you very
First
much.
Meeting,
Thank you.
Rick. Thank you.
Thank you.
Thanks. Good night.
Night.
Good night.